Welcome to the breathing room. Today's topic is on mind-body connection, in particularly regarding autoimmune disease. I'm happy to have with me Dr. Sanat Phatak.
I have a mentor, Dr. who's a rheumatologist in the USA, and he always jokes that medicine is a branch of rheumatology. So,
yes.
Lupus, for example, where the immune system can attack the kidneys, the brain, the lung, the heart. So those are sick patients and young patients. So those are
young.
So if you have a patient in whom you're dealing only with the inflammation and not really considering that there is a behavioral component to their pain, then you're only dealing with part of the problem.
So you send them to a mental health professional?
Yes. So you remember the times when you have a fever, you have a viral infection and you feel low, you don't feel like doing anything even after the fever has gone. So that's the effect of inflammation.
Yeah, if we need more specialties, we'll just add immuno to it.
Exactly.
Welcome to the breathing room. I'm Rita Date, your host. I'm a yoga and meditation coach, nutritionist, and author. On this show, we talk about M&M, mind, nutrition, and movement. 3 pillars you need to lead a healthy life. You'll find practical information backed by science. Stay tuned. Today's topic is on mind-body connection, in particularly regarding autoimmune disease. I'm happy to have with me Dr. Sanat Phatak. He is an MD in rheumatology. In addition to a busy medical practice, he has ongoing research projects which we will be hearing about. So welcome, Sanat.
Thank you.
Yeah,
Pleasure
thank you
to
for
be
being here. Yes. So tell us, what exactly is rheumatology, and why would somebody visit a rheumatologist?
Yes, that's a good question to start with because many people have not heard of this term before. And if I'm really being frank, it's kind of vague also. But essentially, it's good to remember that we deal with diseases of the immune system, particularly ones in which your own immune system is attacking some kind of self-tissue. So these are diseases that we call autoimmune. Having said that, most autoimmune diseases, or a lot of autoimmune diseases, affect the joints. So we do have inflammation in joints. And therefore, people also kind of consider us as doctors dealing with the musculoskeletal system. So we treat arthritis, we treat muscle inflammation, we treat tendon inflammation. So a lot of these things move around the locomotor and the musculoskeletal system. So we also deal with degenerative conditions of the musculoskeletal system. So it's kind of spreading across the spectrum.
And how did you choose rheumatology?
Rheumatology is exciting in a few different ways. It's very clinical. So a lot of it has to do with talking to patients, examination, the traditional kind of internal medicine that we were taught in medical school. So we are still very much in touch with clinical medicine, and it's not a lot to do with a lot of investigations. Secondly, they are complex problems. They are sort of diagnostic dilemmas, and it's good for the cognition.
I read that or heard that somewhere, that you like to solve puzzles.
Yeah, so they are complex puzzles often. So that was my second thing. And thirdly, it's also quite deeply human because these are chronic long-term conditions. So we are not only dealing with the disease, we are dealing with the person as a whole across their lifetime. We are dealing with their pain, we're dealing with function. So it has a very deep human connection as well.
Wow. So I have to tell you that my son had an autoimmune disease, and the rheumatologist figured it out.
Yes.
I mean, he was seen by a skin doctor, a liver specialist, all specialists, but the rheumatologist figured it out. So I have a lot of respect for
I have a mentor, Dr. who's a rheumatologist in the USA, and he always jokes that medicine is a branch of rheumatology. So
yes. If you're following a patient through their life and listening to them, that's a big thing.
Yeah.
So what disorders do you see a lot in India? Rheumatologic.
We see diseases across the spectrum of systemic autoimmune diseases. So the most common autoimmune disease that we treat is rheumatoid arthritis, which is joint inflammation but can also affect other organs like the lung and nerves. We see a fair amount of degenerative joint diseases like osteoarthritis, where there's degeneration of the joints and therefore producing pain. We see more serious and more systemic autoimmune diseases where the immune system will attack more vital organs, such as lupus, for example, where the immune system can attack the kidneys, the brain, the lung, the heart.
Oh, wow.
So those are sick patients and young patients. So those are
they're young.
They are young. So most autoimmune disease patients. So, for example, rheumatoid arthritis, the mean age of onset is around 40.
Okay.
In lupus, it's even earlier, so it's about the third decade. But we also have kids, so about 15 to 20% of people with lupus will be below the age of 15. So, what we call juvenile lupus. So, we see kids as young as 2 years old and 3 years old as well. Yeah.
Oh, that's tough.
It is, yeah, and I mean, it's going to be with them for the rest of their lives.
So, have you seen a link between mental health disorders and autoimmune disease?
Yes, absolutely. In the sense that I like to think of it as effect modifiers. We know for a fact that about half, 30% to 50% of people with chronic autoimmune disease will have at least a certain level of depression or depressive symptoms. And it is also closely linked in the sense that having a mental health disorder alongside an autoimmune disease will affect how well they're dealing with medications, how well they're doing in function in their lives. So we need to recognize that. We need to recognize that the prevalence is so high. We need to screen for it. We need to treat it. Only then are we really making enough or giving the patient enough justice.
Right.
If you have a patient in whom you're dealing only with the inflammation and not really considering that there is a behavioral component to their pain, then you're only dealing with part of the problem.
So you send them to a mental health professional?
Yes. Or yes. So
how's our mental health with the professionals in okay, let's say Pune. Do we have enough of them? They're qualified. I mean, how do you find the network?
So there are multiple hurdles in the sense that me asking a patient to go is one thing, but them going is another thing.
Okay. Okay. So you refer them, but they may not go.
They often.
There's still a stigma.
Yeah, there is something of a stigma. Yeah.
Okay.
So I mean, the mental health community is great, and they are always willing to help. So we have psychologist collaborators and psychiatrist collaborators, etc. But the uptake may not be as much as I would like it to be.
So we know that mental health has some impact on the immune system.
Yeah.
It's not necessarily the only thing. I mean, there's so many factors.
Absolutely.
But how strong is the mind-body connection, and what can we do to strengthen our mind to improve our body?
Yes, so I'm going to answer this in the context of autoimmune disease.
Okay, yes.
And I believe in this, it's a two-way context, it's a two-way street. So we know, for example, that there's a high prevalence of depressive symptoms or other behavioral problems in patients with autoimmune disease. And like I said, it will affect how well that patient is doing, how well they are responding to the medications or going back to their normal functioning. It's also the other way around, that inflammation itself has an effect on your mental health. So you remember the times when you have a fever, you have a viral infection and you feel low, you don't feel like doing anything even after the fever has gone. So that's the effect of inflammation. That's a very biological effect. People have found that even in endogenous depression, the difficult to treat ones have subclinical inflammation. So their inflammatory parameters are high. So we know that inflammation produces an effect on the mental health or the behavioral system as well.
Wow, yeah.
So it's a very it's very closely linked.
Yes.
You will need to look at both. So if we also want to deal with chronic inflammation, but we also want to deal with the behavioral problems independently. What is also known that there are many mechanisms of how the psychological and the mental and the immune system interact. So we know, for example, that chronic stress will reduce levels of a hormone called cortisol. And low cortisol levels reduces immune function. So we know that when immune function is low, you're more susceptible to infections. And we know that people with low cortisol levels, even due to chronic stress, are more susceptible to infections. So there are other mechanisms as well, due to which these two are biologically linked.
So when you see all these influencers or ads or things saying, boost your immunity with I don't know, Horlicks or or this supplement or this thing.
Yeah.
What are you feeling? Are you like really angry, or you're like what happens?
Well, I mean,
can you boost your immunity?
I mean, I have many questions for people who say boost your immunity. How do you know that you need to boost your immunity?
Yes.
Because immunity is not like thyroid function. Thyroid function, we know that your hormone levels are low or high, and therefore we know that the gland is working enough or not enough, and then we know that we need to boost it or not. How do you know that your immune system is weak? How do you know that your immune system is strong? Because it's only going to be effective when an infection comes in. And like I always say, in the immune system, too much is also bad. So all the diseases that we treat, for example, are not when your immune system is acting less than what it should. It is acting more than what it should in incorrect circumstances. So it's, do you want to boost your immune system when it's already acting very high? Probably not. I mean, I wouldn't think so. So that's the problem, that the major hurdle in thinking about boosting immunity is that we don't have very good measures of the immune system. In the same way that we have measures of metabolic health or we have measures of, let's say, endocrine health, we don't have very good measures of the immune system. And therefore, saying that, something does increases it or something decreases it, how do you know? Because if you can't measure something, how do you know it increases it?
You get less colds, you're less sick.
Correct.
I mean, it's not concrete.
It's not concrete. It's very difficult to systematically collect data when it's going to be 5-year data or 10-year data to say that, really my frequency is gone down or my inflammatory parameters are changed. So it's a difficult question to answer. I mean, I would just tell the influencers that, be a little more humble in what you're claiming. I'm not saying that it's false, but we need to have better data to say that if it is true or not.
Yes, I agree. So I've heard this term, I read it when I was doing some research, psychoneuroimmunology. And can you explain its relevance to your field?
Well, I think this harks back to what we were talking about, is the connection between the mind and the immune system in particular. So we already talked about the putative mechanisms, that how the psychological systems are affecting the immune systems and how the immune systems are affecting the psychological systems. So I think it's just essentially, it's a... so the immune system is closely linked to everything. So I mean, in that effect, you could have, immunogastroenterology and
that's true. That's true. Okay.
I mean, you could link the immune system to nearly everything.
If we need more specialties, we'll just add immuno to it.
Exactly. But coming back to it, it's a useful term because then it raises awareness of how these two are linked.
Right.
And how you really need to deal with both. You can't just deal with them as silos.
I just want to know, what is fibromyalgia, and is it really closely linked to stress, and is it very prominent in your practice?
Yeah, we do see a fair number of people with fibromyalgia. So fibromyalgia is a disease in which there's problems with pain sensitization. So I'll just go back to it. So suppose I get hurt here. How I know that there is a problem here is because there's a receptor and then a nerve and the spinal cord that carries the pain signal to the brain, to the sensory cortex. So this is what we call the pain pathway. what fibromyalgia is that even without getting hurt, this pain pathway is active without reason.
Oh, so you get pain for no reason?
You get pain for no reason, or something which should not cause pain, like maybe touch, produces pain.
Okay.
So it's like a volume knob turned very high. Everything is unpleasant. When somebody catches you, people with fibromyalgia don't like to be hugged, for example.
Okay.
Or they don't like to be held, because touch for me, which is sometimes welcome, is pain for them.
Yeah. Right.
So, and it's a cluster of symptoms. It's not only pain. So, because these pathways are more active, you do get a lot of fatigue, you do get sleep disturbances, you get brain fog, sometimes even soft tissue inflammations. So, it's more a cluster of symptoms. It's very common. So, we deal with it quite a bit. The main trick is to realize that the problem is not where it is paining, but the problem is on the way to the brain. If you don't realize that, you end up treating inflammation or something like that. So there are people who will have pain in various joints because of fibromyalgia. They will get imaged, they'll get MRIs, and those MRIs come out to be normal or some amount of degeneration. But it's really the pain pathways which are overactive.
Pain pathways. Yeah. Is it stress induced or?
It has. It's not. I wouldn't call it stress induced, but amongst the rheumatic diseases, it's got the closest relationship to emotional stress and mental
it does
stress.
amongst all the
Yeah. So emotional stress, mental stress will increase pain, will increase fatigue. That's very well known. Also, a large part of the treatment of fibromyalgia, apart from medications, are physical activity. Certain kinds of activities like Tai Chi have very good evidence, for example. So, when there is emotional stress, even those go down. So people end up not doing those. And therefore, they're sort of going back into a vicious.
Yeah.
So fibromyalgia, exactly. So it's very difficult to separate the two. Essentially, you have to treat both.
So you mentioned, you have a on premises, you have a space where sometimes you do yoga or other activities.
Yeah.
So would you start a group telling, okay, you have fibromyalgia, you should do this? Have you considered that? Or?
Yeah, I mean, I would lead them to it.
Yeah, but you I know you cannot force them.
No, in the sense that also I wouldn't personally know what exactly is to be done, because they are professionals.
Yes.
So there are people who would know what exactly to do and what exactly is going to help them the most. But in general, we know that yoga, Tai Chi, flexibility, and in fact even cardiorespiratory exercises. So the earlier evidence came for cardiovascular and cardiorespiratory exercises. So running, jogging, cycling, those kinds of things. The flexibility evidence has come a little more recently.
Okay.
So we do advise a mixture of both, a bit of flexibility, a bit of strength training, a bit of cardiorespiratory, yes.
Yeah, what is it? Exercise is the best cure, or not cure, pill for depression or any mental disorder. Yeah.
So it's definitely a large chunk of how we deal with fibromyalgia.
And can you give me some examples in your practice where mental health interventions have helped? Have you seen,
we have seen quite a bit. And I feel the main advantage or the main benefit that someone with a mental health intervention will get is improving their functionality. It's more than improving, let's say, suppose I have, even improving pain. Let's say I have a patient with rheumatoid arthritis. How I would measure the activity of rheumatoid arthritis is counting the number of swollen joints, or looking at the number of inflammatory parameters. So we have disease scores which will tell us how inflamed or how active the inflammatory disease is. But there's a whole different thing which is downstream to that. So because of this, how well a person is functioning, how is their global functioning, how is their pain perception, all of that.
Okay.
So mental health interventions may have some effect on, let's say, the more biological inflammatory parameters, but that's not the only thing that we want to treat. They have a very large effect on pain perception, functioning, and to me that is a more tangible end to treatment than just bringing down inflammatory parameters.
Okay. So, have you ever given anyone just like a placebo? Does that ever work?
Well, placebos do work. I don't think I have prescribed anyone a placebo as a placebo.
Okay.
But I mean, they come out from patient stories. What one feels is placebo, right? So I mean, there are people who will say that I did this, or I ate this, or I had this particular medication, and to my mind, there's no biological plausibility about why that would work. Maybe it does. I mean, I'm not saying
there's no
that
evidence of
there's
it
not
as-
much
as yet,
evidence.
yeah.
So, but it helped them, and it is very well known that placebos work. So, placebos will work in pain perception and function. They may not work in actual inflammation.
Inflammation.
But again, I mean, more than welcome. We are happy to use them.
Okay, great. So, in India, there's a lot of Ayurveda and, homeopathy. How does that fit into rheumatology? Do people come to you after they go to an Ayurvedic doctor and ask you a lot of questions? And does it have any efficacy? Like, what is your...
Yeah, so many people do use it, and people get benefit. So, I mean, I don't have too much knowledge about Ayurveda or homeopathy to say if something is more useful than the other within it. But just to say that it's a reality in practice in India. So even if it's a parallel field or a parallel way of thinking, it's definitely there.
Yeah.
And I mean, we should not deny someone benefits just because it doesn't fit into our sort of scientific framework or line of thinking. So, and people use it. So
But they should know what it is. For example, like Ayurvedic medicines, if it's prescribed, it's
Yeah, well, so if they are getting benefited, then that should be fine. The only thing I get concerned about is when two kinds of medications come together, because we don't know how they will interact.
Right.
And by chance, if the active principle in both medication is the same, then there's a possibility of overdose and adverse reactions and things like that. So I would measure doses according to weight and response and all of that, and then suddenly if there's another very similar medication, then I'm not really in control of the dosages.
Right.
So that is the main concern about mixing two oral medications or two intravenous medications. But I mean, people, I feel, find a homeostasis.
Oh, that's wonderful.
So they will use one kind of system for one kind of problem, and then often they would use modern medicine for acute problems and alternative medicines for more chronic pain, etc. Which is fine. I mean, as long as they are doing well, they are happy.
That's good. That
I'm okay. Yeah.
You don't discourage it, basically.
I don't discourage it apart from mixing the
messages, medicines. Sorry, yeah. Okay. What about diet and lifestyle?
Diet and lifestyle do make a difference for sure. So again, there are a couple of things which I mean, people are very interested in knowing how diet and lifestyle affect the disease. I think part of it has to do with the very deep focus that Ayurveda has on making dietary changes as a part of your treatment. So part of it comes from that. We don't have too much evidence to say that one particular food improves autoimmune disease or one particular food is not helpful. We have some amount of evidence that certain foods have an anti-inflammatory effect, and those are fine as add-ons. They are not, the quantum of effect is not as high as to replace medical treatment.
Oh, absolutely. Yeah.
So
this is just a supplement.
Correct, and that needs to be told because often people would think that just because, let's say, I'm taking curcumin and curcumin has an anti-inflammatory effect, I may be able to stop medications, which often does not work.
Right.
So So it's a very useful supplement to have. There are certain diseases that we treat like gout, in which there is good evidence of what increases, let's say, uric acid levels and what reduces uric acid levels. So there are certain types of diseases that we treat which have very direct effect on what we tell them to eat and what we tell them to avoid. But with the immune system diseases in general, we don't have too much evidence on particular foodstuffs.
But you have evidence on I mean, obviously, in the last 20, 30 years, our diet is really gone. Do you think the diseases have increased?
Well, there is good evidence to say that, for example, fat tissue produces inflammation. And we do know that reducing fat tissue, so losing weight while keeping muscle mass, is useful to reduce inflammatory parameters and improving disease activity parameters.
So obesity is
an effect modifier that is, if dealt with well, can really help pain and can really help even inflammatory disease activity in patients with arthritis.
So if you reduce your weight, I mean, if you have obesity and
I mean, of course, it will be individualized. Some people are very thin because of the disease itself. But if that's a risk factor, then it does help even in inflammatory disease. We do, and there's animal evidence even in intermittent fasting or time restricted eating that such things will help inflammation and reduce inflammatory disease activity.
That's coming up. I mean, it's much more out there right now about fasting
and also, I mean, in a more indirect sense, I know it's not about food, but these new medications that are all
Ozempic and
the GLP-1 analogs are known to have certain effect in, let's say, osteoarthritis, in pain, which is independent of just the weight.
So they do help. They help.
There are some trials which have come out recently.
That's because the weight is reduced, or because of the medicine?
So even apart from the weight,
I see.
It's been shown to reduce pain.
Okay.
And not that I'm promoting them, but
yes, I understand.
But I'm just trying to stress upon the close relationship between metabolic health and inflammatory disease.
Yes.
So as long as you keep your metabolic health healthy, and it does not need to be some newfangled things. It can be your traditional ways of being metabolically healthy, whatever, fasting, exercise, boring stuff.
Long term, not a quick
consistency.
Pill.
So that will help inflammatory disease. That will help pain. That will help the behavioral aspects of it, function, all of it.
Okay.
And thirdly, some people feel that certain foods increase symptoms. Again, we don't have too much sort of mechanistic information about why they should do so. Many people, for example, feel that sour foods will increase symptoms of arthritis.
Oh, really?
I don't know if it's a nocebo effect or if there's something there. There might be. I mean, it's just that it's not explored, and the absence of evidence does not mean that there's evidence of absence. So
Yes. Okay.
So
I'm sure.
So
I'm sure that's an area of research, or
that's a clinical question that comes from patients, and that could. I mean, it will be really nice to know if it is happening, why it is happening. But so in those particular people, we will say, it will be good to have a food diary. Just make sure that it's repeatedly shown that if you feel that drinking lemon juice is increasing your symptoms, make sure that it is consistent, that relationship is consistent and not a one-off. Because then when you start cutting off things from your diet, you're left with fewer and fewer things for nutrition. So if it is consistent, if it is always going to cause pain, then sure,
it's good to have
do without that
diary. That's very good. I mean, I know there's a lot of information on the brain health these days. And it's already been proven that all these like ultra processed foods and junk foods are bad for your system in all different ways, from head to toe. So
there is evidence, of course, that processed foods are bad for you, even from an inflammation point of view.
I think the next thing is Alzheimer's. People are trying to tell you eat this, boost your chances of not getting Alzheimer's, etc.,
Yeah,
etc.
yeah.
So
Yeah, correct.
food is it's a rabbit hole.
Yeah.
You know, it's
Yeah. There's a lot of evidence how the main thing that I feel we don't know is the quantum of effect. So it's a lot like let's say the vitamin D story, where we know that vitamin D affects many biological processes from almost every cell in the immune system.
And we didn't know this 20 years ago.
We didn't know it 20 years ago, we know it now, but yet it does not work in clinical trials in a particular. So we know, for example, that vitamin D affects immune system health, but just vitamin D treatment for inflammatory
Okay,
disease
yes.
has not shown evidence. It can be, of course, added on, and it'll help when it's low. But we don't have trial evidence to say that only that will help. So that's what I'm talking about. That how much
Yeah.
is the quantum of effect? I'm sure it's helping. How much is it helping? Is it helping 1%? Is it helping 20%? Will it replace something else?
Okay.
That's something that we don't know. And the same with food. Yeah.
Same with food.
Yeah.
So you're a young and healthy doctor. What is your diet like?
Good question. I eat twice a day, and
Regular thali, Indian
yes,
food,
Yeah, Indian food. Yeah.
roti sabji.
Roti sabzi.
Okay. Okay. What advice do you have for your patients or the audience about how to keep a strong mindset or a positive mindset going forward?
Yeah. So I'm going to address this for people with chronic disease because that's essentially whom we treat, and especially immune disease. I would think that one moves from a feeling of helplessness to a feeling of participation. So when you are a stakeholder, and you are the stakeholder, I mean, it's your life that we are treating, it's not my disease that I am treating. So you move from, it's always better for you when you move from, a helpless, passive acceptor of treatment to making decisions of your own. Secondly, it's good to think about moving past the actual biology of it and thinking about function. So, for example, I often tell my patients who have shoulder arthritis, let's say, that I don't use my shoulders all day. So, even if my shoulder was completely degenerated, maybe I won't be able to do one or two things during the day. But the rest of my life will go on as usual.
You can't go trekking. You can't put a backpack on. That kind of.
Correct, but I
not
mean,
the daily, not the daily
exactly,
stuff.
Yeah,
Okay.
yeah. So if my shoulder doesn't go above this, for example.
Okay.
That just as example. So often function is preserved even if there is some amount of damage, there's some amount of inflammation. So it's nice to think about that. So how within my realm of living, how it is going to affect me, and if it is not going to affect me, of course one treats the disease, but it's nicer to focus on what all I can do.
Yes, that's a good point.
Yeah.
I think especially as we're getting older, there's always something creeping up.
Yeah.
It's just management. Nobody is going to have the perfect body.
Absolutely.
Right?
Completely.
So there are some people who are blessed.
Yeah.
Or they're the ones that don't show it.
Yeah.
They just go on doing their thing. They don't talk about it too much, right?
Absolutely.
Yeah. And we're in a yoga studio. How do you find mindfulness and meditation? Just like, nobody ran 30 years ago, 40 years ago.
Sure.
Running wasn't a thing.
Yeah.
So I think that, meditation is going to be the next running, you could say. People will need to meditate.
Yeah.
So what do you think the same, or what do you think?
No, absolutely. And we have evidence for that now. There are clinical trials for mindfulness-based treatments in rheumatoid arthritis, in other autoimmune diseases. From what I remember, most of them have shown good results in pain perception, functioning. You may not find evidence for reducing inflammatory parameters, but that's fine. I mean, that's not what we are looking to do. We are not everything that we are doing is to reduce a test result.
Yeah.
Which is often a problem. I mean, when we tell people that, I feel you're doing well, and they come up to us and say, I mean, this test result, something is underlined. That's okay as
Sometimes
long
you just
as
have to see the patient, right? Yeah.
So it's a more global picture.
Wow. I think I'm just gonna maybe ditch my physician and come to you. So, and finally, I'd like to know a little bit about your research. What kind of that's your passion,
right?
Kind of. So,
No, I mean I like.
No,
I mean, I like
you do
patient
many
care
other
as
things,
well,
but as far as your
yes,
field
so,
of work goes in
yeah,
rheumatology, I
right.
mean, yeah.
So we deal quite a bit with the interface of metabolic health and musculoskeletal disease. So I have some research ongoing which is looking at what diabetes does to your musculoskeletal health. We know that people with diabetes have a higher risk of developing, let's say, frozen shoulders or hand problems, grip disturbances, all of those things. So we are looking at how we can measure those things, how we can deal with them around those conditions.
So people with diabetes, how you would...
With diabetes or with metabolic disease, the peculiar kind of musculoskeletal problems that they face, especially since metabolic health is worse in India as compared to what it was.
Yes.
Economic transition, all of that. Secondly, we as a research group, we have interest in sort of democratizing how all these diseases are diagnosed. So we are looking at computer vision and things like that. So using technology to try and diagnose rheumatic diseases early. Using photographs and other things. Yeah.
Okay.
So, which is also quite interesting.
By photographs, you mean like
smartphone photographs?
Smartphones.
Yeah,
really?
Yeah,
okay.
Yeah. So, I mean, these are just ongoing projects. So
okay, nice.
I wouldn't claim that we have tests available or things like that. But research has a long trajectory. Yeah.
That's
I mean, you have to. The thing about research, I tell all the kids that work with me who want to sort of try their hand out in research is that the only exciting part about research is the start when you think of the problem and how you're going to solve it, and the end when you actually get data, and everything in between is just
grunt
repetitive.
Work. Yes.
In fact, it's bringing structure to something that you're doing otherwise.
No.
So I mean,
you have to have a different mindset.
If I see a patient and I come to a diagnosis and I treat them, I'll get happy. But if I put that entire thing in a framework and I keep doing that again and again and see if it is working or not, then that's research. So
you have a good mix of both.
It is, yeah.
That helps. That helps.
That helps, yeah.
Yeah.
Yeah, that, I mean, also helps us go back to see if things that we are doing are correct or not. Yeah.
Right. You need the actual.
Yeah. You need the data to see that. The data might disagree with you even if the patient doesn't.
So wonderful. This has been fascinating information. And so now everybody knows what a rheumatologist does and the mind-body connection. So where can people find you if they need you, want to reach out or?
So I'm on LinkedIn. I'll give you an email address and
sure.
Like that.
I'll put it in the show notes.
Yeah.
He practices in Pune on Deccan Gymkhana, and
the KM is my main hospital.
KM is the main hospital. So thanks.
Thank you,
Doctor. It was a pleasure, and we'll have you back on.
Yeah,
lots of mind-body connection topics we can talk about.
Absolutely.
Did you want to ask me a question? You said you had a question for me.
So if it's, I think it's going to marry your interests in yoga and like questions around it. So how do you feel we can generate evidence around yoga? Let's say help it break boundaries across. We know that yoga works, but it's anecdotal. It's intuitive. How do you break that and tell the world that yoga works? I
think the world already knows.
Yeah, the world's starting to know. Yeah.
You should see the studios and the parks in the US. At least that's where I can tell you, it's packed. I mean, you go to a yoga studio. There's only this much space between the mats.
Yeah.
I mean, it's doing something.
It is, yeah.
In addition, I've been doing it for 20, 30 years. I've seen my students, I've seen my peers, I've seen other yoga teachers. But I don't think we're taking enough advantage in India, right?
Yeah, exactly.
We don't know, not all of us know the value.
Yeah.
You have to do it the right way, with the right, know the right
Absolutely.
system.
Yeah.
If it's a fad that gets you into yoga, that's fine. Just come. Because once you're in, you won't
Then
leave.
you'll keep.
Yeah. So, it is 5,000 years old. There's now evidence on, pranayama. They're doing, calling it breath work. And breath work is a little different, but they're saying it's a breath method, or they're calling it different names after the research is done, which we had the research done many years ago. So it's an ancient science. It's here to stay, and it's only going to grow. Yeah.
That's amazing.
Yeah.
I mean, I'm hoping it does.
Yes. Thank you.
Thank you.